mental health care?
So really what I want to highlight, if you get anything from this presentation at all, is the importance of understanding occupational therapy and mental health. You might be thinking to yourself, I don't want to work in a psychiatric hospital. I don't want to work in a mental health setting. It doesn't really apply to me, but I'm here to tell you it does. Mental health exists in every setting of practice that you can possibly practice in. For example, if you're going to work in pediatrics, early intervention, like they're talking about, you are likely to encounter parents with postpartum anxiety, depression. If you work in geriatrics, there's a population of people who have chronic, lifelong mental health diagnosis. So that's why this is so important. And that's why that's one thing I want you to take from this if you don't take anything else from it. That's my topic. I said that right. So occupational therapy has been involved in mental health care since the founding of the profession itself. In those early days, OTs commonly worked with soldiers returning from the First World War, experiencing what was known as shell shock, what we now know to be post-traumatic stress disorder. And these individuals were engaged in occupation, often handicrafts at that time, which is sort of where the association with OT and being crafts therapy sort of came about. But it was still very beneficial to these individuals, and that's sort of where. So using occupation for therapeutic benefit in mental health actually predates occupational therapy itself as a profession. In the 18th century, the moral movement is a sort of a huge moment and a huge shift. We see this shift towards compassionate treatment for those with mental health diagnoses. Prior to this, not a very compassionate experience for those individuals that were mental health patients previously in humane treatment. And this shift towards compassion was much needed. During this time period, there was a lot of belief that the urbanization and the industrialization, the large cities, was a huge contributor. And so a lot of the things done during this time period are sort of a shift away from industrial and urban settings was supposed to help cure these people. With this shift, there's also a shift towards optimism that these mental health diagnoses could be helped, that these people could be cured. In this time period, Dorothea Dix is a notable public figure, a notable public advocate for asylum reform and the creation of more compassionate and safe environments for these people. We also see a shift in the later part of the 19th century from the rest cure to the work cure for mental health diagnoses. So the rest cure was sort of the belief that not only physical rest, but mental rest is the avoidance of any work or any stress or strain psychologically or physiologically would be what would help you. And then we sort of transition to the work cure, which is using the engagement in occupation to benefit the patient. And this is where we see the roots of occupational therapy in mental health care.
So my area of focus is on adverse childhood experiences, which are traumatic events occurring in a child's life that can lead to a negative impact on one's future health, opportunities, and development. And this can develop in various ways, such as abuse, neglect, or household dysfunction, such as substance abuse, divorce, or an incarcerated relative. And according to the CDC, in 2022, 61% of adults surveyed across 25 states encountered at least one type of ACE. There are also various methods of prevention for ACEs. The first one is creating a safe and nurturing relationship with your child, which allows children to reach their full potential and decrease the risk of ACEs. The second method is strengthening economic supports to family members, such as household security and family-friendly work policies. Promoting social norms against violence is another method, which can be approached through public education campaigns and family relationship education, and also teaching skills revolving around social emotional learning, healthy relationship skills programs, and high quality and safe childcare. There are various psychological and physiological impacts of ACEs, such as impairments in emotional regulation, executive functioning, and autonomic functioning, which has a link to metabolic dysregulation and cardiovascular disease. And due to prolonged adversity and toxic stress in an individual's life, there is an overload of cortisol in the neuroendocrine and immune system, which disrupts the development of brain circuits and can lead to irreversible changes within one's neurochemical systems. And ACEs also increase the likelihood of developing alcoholism, diabetes, heart disease, and mental illness such as PTSD, anxiety, depression, emotional dysregulation, and traumatic victimization. Occupational therapy plays a huge role in ACEs. They promote positive behaviors, coping skills education, and safety mechanisms through the utilization of emotional regulation strategies, cognitive behavioral techniques, and self-awareness techniques. They also provide education on how to effectively deal with stressful situations, healthy discipline techniques, and positive behavioral supports through the utilization of a trauma-informed care approach, which focuses on areas that are pertinent to clients who have experienced trauma.
Emotional regulation. Emotional regulation is defined as manners that influence an individual's emotions when they have them, which ones they have, how they're expressed, and how they're experienced. The first 5 years of the child's life is when their emotional regulation is molded with these three principles, including the responsiveness of their care provider or parent to their needs, the parent's use of appropriate language, and the parent's use of joint planning, negotiation, and anticipatory guidance. Emotional regulation interventions include sensory equipment such as weighted vests or blankets, quiet rooms or sensory rooms, sensory stimulating activities such as aromatherapy, tactile fidgets, music for auditory stimulation, hot cold packs for temperature stimulation, a rocking chair for vestibular stimulation, and then bubblegum, sour candy, as well as a identification of the current state. How is my body feeling? What does my body look like? What zone am I in? Which brings into the zones of regulation. Like I said earlier, blue zone, green zone, yellow zone, red zone, and this is a way for kids to it puts it into a picture of which zone they're in.
So throughout the ever-evolving shifts and changes in the past more than 100 years, of a profession, occupational therapy has stayed true to connecting people with meaningful occupations for therapeutic benefits. OT practitioners promote positive behaviors, coping skills education, and safety mechanisms through emotional regulation strategies, cognitive behavioral techniques, and self-awareness strategies. Self-regulation. The use of emotional regulation interventions and understanding of emotional regulation.
And then here are references.